I'm leading into Dr. Cooper. Since 2018, I've been calling on the Federal Trade Commission to conduct a study on drug middlemen, including pharmacy benefit managers. Last summer, FTC agreed to conduct such a study. Given there is little known about the actions of PBMs, their business practices are very opaque, as you know. I believe this study must be conducted timely. So to you, is it important for the Federal Trade Commission to complete a study of PBMs in a timely manner? And if so, tell me why.
Thank you, Senator Grassley. I absolutely agree with you that it's important that the FTC looks into pharmacy benefits managers. I think it's important that Congress does as well. It's this enormously opaque industry, and I think you want to think about it as sort of the Sam's Club for prescription drugs, right? They're doing bulk purchasing, and sometimes that's good if they get better. The challenge is the industry's gotten so consolidated that it's not clear they're passing any of those savings along to either the government or the customers. And with so much sort of, given what's happening in the environment around us, haze in the air, I think the FTC can help us get a better window into what's happening.
Yeah, and also for you, you stated in your written testimony the importance of better understanding the growing vertical integration of health insurers acquiring PBMs. Are these acquisitions resulting in lower drug prices at pharmacy counters, improves access to local pharmacists?
So I think when it comes to vertical integration, the answer right now is we don't know, and it speaks to the need to investigate it. I think there are a lot of reasons we might think that vertical integration of pharmacy benefits managers and insurers makes sense. So we have seen studies that when you can coordinate medical and pharmacy benefits, you see drugs on formularies that you don't otherwise see that are good for basically keeping people out of the hospital and increasing savings. The worry is that when insurers have so much market power and they integrate with a PBM, do any of those savings get passed along? And I think that's what we need to study. The other is when they own pharmacies, the question is, does a totally vertically integrated unit let customers go to small independent pharmacies, or do they close off their rivals from accessing their pharmacies? I think we need to look into it.
Yeah. Ms. Pearson, I've written to I'm going to ask you about price transparency, but leading into that, I've written to the Department of HHS, Treasury, and Labor about implementing prescription drug transparency regulations as required by the No Surprise Act and price transparency regulations. Despite the response from the agencies, very little has changed. I believe in sunshine in these drug prices. So you discussed in your written testimony the importance of implementing this sort of drug transparency rules and the need for this data. Why do you think the agencies are unwilling to publicly publish this data?
I can't speak to, thank you, Senator, for the question. I can't speak to the motives of the agency. Certainly, as the data is coming out, we've seen some of the challenges with data quality, and I expect that folks are trying to make sure that the data that they're receiving is, robust and comprehensive. There have also been a number of legal challenges, but certainly we believe that transparency across all services is going to be beneficial to really understanding the market and the cost drivers. And so I am very hopeful that we will begin to see more of that information in the future.
Also for you, you stated in your written testimony that newly established price transparency data must be used in ways to benefit healthcare purchasing decisions. Have employers, groups, or associations effectively used this data to negotiate better health insurance premiums?
Thank you, Senator. As you know, employers are the leading purchaser of health insurance in the country, and so they're a very important stakeholder in order to drive down cost. They have worked for years with their companies that support them to try to give more information to the employees, to really motivate people to shop and to pursue care with lower cost providers. That has been incredibly challenging. Lots of research has shown that it's very difficult for consumers to shop for services. First, because many services that consumers need aren't shoppable, right? It's not planned, and so there's simply not enough time to make those decisions. Two, good information about the cost of services is hard to come by. People don't know what the episode of care is going to be. They don't know everything that they're going to need when they walk through the door. The No Surprises Act took a big step forward in requiring some of this information to be made public and to be put into the hands of patients, and so we commend that. But ultimately, I think it's going to be really the physicians who the patients really depend on to advise them, putting the information into their hands, as well as putting it into the hands of the employers and the health insurers who are really responsible for negotiating rates and building provider networks around high-value providers.